Good evening, and again, thank you so much for joining us, and welcome to tonight's special event presentation on Nature's Answers for Viral Infections. Before we officially kick things off tonight, I'd just like to let you know that you do have options for your audio connection. If you are on your computer, of course, you can feel free to listen to the audio that way. However, occasionally the sound may drop out, or if you get better sound quality on your telephone, you can feel free to call in at any time. We have the telephone number and access code that will appear along the bottom of all the screens, so you will be able to switch over audio at any point if you wish. If you have questions for our presenter this evening, you can use the Q&A box, which you will find on the right-hand side of your screen. For most of you, it will appear up along here, along the top for a Q&A button. Depending on whether you're using a PC or a Mac, that may change. But if you click around here, you should find the Q&A option to go ahead and send us a message. Now, we will hold those questions until we've gone through the main part of our discussion, and then we will go ahead and move into our questions and answers. At this point, it's my pleasure to welcome tonight's special presenter, but first I would like to say a special thank you to our friends at Mother Earth Foods in West Virginia for helping to get the word out regarding tonight's presentation. We really appreciate their support for helping us get this event and make it an actual happening. And our presenter to bring you this information tonight is Cheryl Myers. Cheryl is an integrative health nurse, an author, and an expert on natural medicine. She's a nationally recognized speaker who has been interviewed by prestigious publications, including the New York Times, the Wall Street Journal, and Prevention Magazine. She's had several articles published in diverse journals, including the Aesthetic Surgery Journal and Nutrition in Complementary Care, and her research on botanicals has been presented at the American College of Obstetrics and Gynecology and the North American Menopause Society. Cheryl has a gift for making complicated health information easy to understand, and her humor makes learning about natural medicines fun and engaging. So we're thrilled to have her with us tonight to learn more about how natural medicines can help us address viral infections. So again, thank you very much for taking the time to join us. And again, thanks to our friends at Mother Earth Foods. At this point, we're ready to turn things over to our presenter this evening, Cheryl Myers. Again, thank you very much, and welcome, Cheryl.
Thank you so much, Jennifer, and thank you, everybody, for taking time out of your busy day to learn more about natural medicine. Today, we're going to talk about something that's particularly timely, and that's the answers to be found in nature for viral infections. Could this be any more timely? Because so many individuals feel this sense of being powerless, of being overwhelmed, of really being so worried about potential exposure, and I certainly empathize with that. However, we are not powerless, and we do have steps that we can take to make our immune resistance stronger. We do have steps that we can take to help our bodies be more resilient in the face of viral exposure. There is so much more that we can do to be healthier and stronger. And so that's what we're going to talk about today. Now, of course, part of that is getting plenty of sleep, finding joy in your life, trying to reduce stress, eating as naturally as possible, eating as simply as possible, drinking lots of fresh, clear water. Yes, of course, there's all kinds of health tips that we can give for making our bodies and our immune system stronger. But today we're going to talk about dietary supplements. So let's talk about the different types of infections. Sometimes we use the word germ. A germ is a microorganism, meaning too small to be seen with the naked eye. So we talk about germs, and germs are things that make us sick. But there's different categories of germs. There's bacteria, there's viruses, there's fungi, and there's parasites as well. So when we talk about these different categories, these different types of infections, they all have very unique characteristics. Now, the good news is the vast majority of bacteria and viruses and fungi and even some parasites are not particularly problematic. They are not necessarily causing infection. They are not disease-causing microorganisms, which we refer to as pathogens. But there are some in each of this category that can cause a great deal of human illness. Now, when I was in school, I had a microbiology professor that said, bacteria are like the animal kingdom. Fungi is more like the plant kingdom, and viruses are from outer space because they are very different than the other types of microorganisms that our bodies come into contact with on a relatively regular basis. So all of these different pathogens can cause disease, but today we're going to focus on viruses. You know, up until a few decades ago, researchers were arguing about whether viruses were even alive. They are so incredibly tiny. They're the smallest of all these groups. They almost look like a couple strings of computer code all stitched together. So when the good news about viruses is they don't have flippers, they don't have teeth or claws, they don't have feet, they don't have fins, they cannot propel themselves. Viruses are relatively inert. They don't move around a lot. In order to become ill with a virus, you have to put it in your body. So, of course, the smart thing is to do your best to not put it in your body. When we're going through cold and flu season, and of course now during the pandemic, one of the things I recommend to people is this is not the time to wear your contact lenses. And unless you have to for a medical reason, switch back to glasses, because we unconsciously touch our eyes many more times a day when we're wearing contacts than when we are wearing glasses. And every time you touch your eye, whatever's on your hand finds an entryway through the mucous membranes of the eye. If somebody coughs directly in our face or sneezes in our general direction, the viruses can ride on those droplets that are sailing through the air. And if we inhale them or get them on our hands and put them somehow into our body, again, we can become ill. So the best things that we can do is to maintain a distance from individuals if they're coughing and sneezing, and to wash our hands frequently, because as I said, in order to become ill, you have to put it there. Now, bacteria are usually harmless. Some of them are healthy. We talk about the healthy bacteria in our intestines that do everything from facilitating the fermentation process to helping to create B12 in our body. Less than 1% of bacteria actually causes harm due to disease. They do not require a living host to survive and thrive and reproduce. But viruses tend to be pretty harmful to humans. There are some that don't cause any problems, but there's also quite a few that make us ill. They cannot survive without a host. They don't live on their own. They have to steal genetic material inside of our cells in order to reproduce. This either destroys the cell or can sometimes even turn the cell into a cancerous cell. So when we talk about things like HPV, human papillomavirus, that infection creates malignancy. They usually target specific cells in the body that they have an affinity for. So some viruses may particularly affect the skin, like warts is a virus. Some viruses may target the nerve tract, like the herpes, like chickenpox or shingles that follow along the nerve tracts in the body. And the newest virus that we're dealing with today is a family of coronaviruses called COVID-19, targets certain receptor sites in lung, heart, kidney, and even in our blood vessels. So the way that a virus infects a human being is that once it's in our body, it attaches to a cell. So first it has to attach itself. That's step one. Step two is it has to penetrate into the interior of the cell. Step three is that it hijacks all of the resources of the cell to become a little virus-making machine. So it hijacks all these resources. It feeds in its own computer code. And so the cell itself uses its resources to make more and more and more and more viruses until that cell can explode and release viruses into our body at a much higher rate. So when we look at what might happen after a cell is infected with a virus, it can damage the DNA and transform it into a cancer cell. So there are certain types of cervical, stomach, and liver cancers that are associated with viral infections. After it multiplies and the cell dies and releases the virus, this is the mechanism that generally happens in influenza, the common cold, and warts. And this in the influenza category includes coronaviruses, and that includes COVID-19. There can also be a slow release of the virus without killing the cell, and we see that in HIV, and we see that in hepatitis, both viral diseases. And the virus is present but doesn't harm the cell, but it later emerges as an acute infection, like shingles, like cold sores, like Epstein-Barr. So antibiotics don't stop viral infections, and I think most people are starting to catch on to this fact, but I think it still needs to be mentioned that people that antibiotics are not going to help you. Now, sometimes a viral infection can turn into a bacterial infection, in which case antibiotics may be useful. But if it's just dealing with a viral infection, antibiotics are not going to help you. As recently as 2012, a survey showed that 36% of respondents believe that antibiotics are effective in treating viral infections like the common cold. And the only thing that antibiotics do when you use them for virus is to create antibiotic resistance. And according to the CDC, almost 3 million antibiotic-resistant infections occur every year, and about 35,000 of those individuals pass away. For example, in some areas of the world, E. coli is resistant to almost every drug known to treat it because we have overused antibiotics. So when we're talking about viral infections, antibiotics are not the answer. There are some antiviral drugs. They tend to be relatively specific. Antiviral drugs are hard to develop because they damage the host cell. So to get at a virus that's wormed its way into our healthy cell, it damages our good cells as well, so they're rife with side effects. There are some antiviral medications that can be used for herpes, influenza, hepatitis, and HIV. Some of them are quite expensive. For example, Solvati, which is used to treat hepatitis C, which is a viral infection of the liver, costs $1,000 a pill, and it requires a 12-week course of treatment for a whopping cost of $84,000. So there are some drugs that are being developed to try to address issues of individuals who have a viral illness, but they are by no means perfect. They are by no means without adverse effects, and there's a lot of individuals for which antiviral drugs do absolutely nothing. So it pays us to pay attention to compounds and herbs and vitamins in our healthy diets and in our dietary supplement section that can help play a role in the body's antiviral defenses. And today we're going to talk about 5 of those, but I want you to know that there's more. For example, before we even get started, is vitamin C important? Absolutely. Your immune system requires vitamin C to function properly. Is zinc important? Absolutely. Is selenium important? Absolutely. There are so many different herbs, vitamins, and minerals out there that play a role in healthy immunity, but I want to focus on these 5 because these are some of the superstars. So, how do natural products fight infections? Well, they tend to fall into 4 categories, and sometimes they have overlapping modes of activity. So, they can be immune modulating. Now, an immune modulator helps the immune system make better decisions of what to attack and what not to attack. It helps to teach the immune system to recognize the pathogen, to recognize the virus more quickly, and to create antibodies. There's also some dietary supplements that are immune stimulating. I call these the bugle blowers. These are the ones that call out the troops. So they blow the bugle and they stimulate the immune system to rapidly create lots and lots and lots of white blood cells so that the army increases in number. Then there are those that are immune strengthening. So they're not necessarily creating more immune army members, but they're making them stronger and they're improving their weaponry so they can be more lethal in their fight against infection. And some have direct antiviral and or antibacterial activity in which they directly, for some mode of action, kill viruses or bacteria or prevent them from replicating or prevent viruses from invading cells in the first place. So let's start with one of my favorites, which is andrographis. Andrographis is called the king of bitters, and where that is not a criticism. In both Ayurveda and traditional Chinese medicine and many systems of botanical medicine, the bitterness of the herb is associated with the strength and the power of the herb. So calling andrographis the king of bitters is like calling it the best of the best, the strongest of the strong. It has been used for a very long time indeed. It has antibacterial and antiviral properties. It is fantastic for your liver. There are some excellent studies looking specifically at things like non-alcoholic fatty liver disease, fatty liver changes, and the ability of andrographis to protect the liver. It has some mild immune stimulation. There's some great studies being done on Andrographis looking at its anti-cancer activity. It does play a role in reducing inflammation, not quite as potently as other herbals, but it's always a nice benefit to have. It has been used to treat certain types of diarrhea. It helps modulate blood glucose levels, and it even slightly lowers blood pressure. Boy, that sounds like almost like an infomercial, doesn't it? It slices, it dices, and now look, at Julienne's, it covers so many different areas because it works at such a foundational level in the body. But today we're focusing on the ability of Andrographis to help people with viral infections. So let's look at a little bit of the research. Here's a study on the common cold. Now, the common cold is caused by a virus called the rhinovirus. And the rhinovirus is like a chameleon. It is constantly shifting. So that's why we don't see vaccines or treatments for common cold other than symptom relief, because it's never the same virus twice. But it's all in the family called rhinoviruses. Now, common cold symptoms, in this group, there were 223 people who had a common cold, and they were treated with either placebo or Andrographis for 5 days, and they looked at symptom reduction. So the first 2 or 3 days, there was a little bit better symptom resolution in the Andrographis group than placebo, but at day 3, boy, did they branch from the pack. All of a sudden, we see a sudden and dramatic reduction in symptoms, especially for sore throats and runny noses and the fevers that need to be reduced in these issues. And when we look at placebo, it sort of leveled out and symptoms did not continue to improve, and it went on for a longer duration. There's also some studies on the ability of Andrographis to help people deal with the herpes virus. Now, when we talk about herpes simplex, there's herpes simplex 1 and herpes simplex 2. Herpes simplex 1 causes fever, blisters, and mouth sores and canker sores. Herpes simplex virus 2 is genital herpes. So I say, well, herpes simplex 1 tends to be upstairs, and herpes simplex 2 tends to be downstairs. Researchers found that a compound in Andrographis called andrographolide inhibits the virus even 12 hours after infection. So what they found is that individuals who were using Andrographis, even if they were exposed to the herpes virus, helped to inhibit the virus from replicating and attaching and causing infection even 12 hours after exposure. They also did a test of Andrographis and compared it to a prescription drug called acyclovir. Now, acyclovir is commonly used for cold sores, shingles, genital herpes, and what they found is that Andrographis works as well as the acyclovir without some of the adverse effects. So when we look at the inflammatory response to a viral infection, and I know this is a very busy slide, and we don't have to go through all of it, but what's really amazing is that Andrographis supports activity that you want and prevents or squelches the activity that you don't want. So it helps to prevent the replication of the viruses, and it helps to prevent a delayed interferon response. It helps to suppress the overproduction of cytokines that lead to that cytokine storm that is a part of acute respiratory distress syndrome, or ARDS. Those are when individuals end up in intensive care and sometimes on ventilators. So it's been shown to deal with every single one of these activities that causes the influenza virus to become lethal. But it's also been shown to make stronger those activities of the body that fight back against the virus, like reducing viral replication, producing and balancing the inflammatory system, helping to boost optimal T cell and antibody responses, helps to clear the virus more quickly. So Andrographis is really a great all-round herbal that helps with the problems that are up front, and also has a powerful impact on the activities of the virus in the body even after infection. So the question is it specifically useful against COVID-19? So in some preliminary testing, they found that the andrographolide that we find in Andrographis has been shown to block the receptors that are targeted by COVID-19 and help to prevent it from attaching to cell membranes. Now, remember when I said that viruses are pretty weak and inert on their own? That, they have to hitch a ride on other things, or you have to put them in your body. Well, the only way that they can replicate, they can't do anything on their own, is to attach to the outside of the cell, number one, penetrate the cell, number two, and hijack the cell, number three. Well, if you can prevent it from attaching in the first place, wow, that's a pretty powerful intervention. And what they found with COVID-19, as I said, it is relatively, the reason it's so dramatic with coming with coughs and fevers and such is that it has a high affinity for certain receptors that are found in the lung, the heart, blood vessels, and kidneys. And when we look at individuals who are struggling with blood clots after a COVID-19 infection, who ever heard of catching the flu and getting sick and developing blood clots? That's not something we traditionally see with the flu, but it's something we see with COVID-19, and these blood clots can be very, very dangerous indeed. That's because of its impact on cardiovascular tissue. So showing that antigrapholide can block its attachment to these receptors, again, is an excellent first step in understanding how it can help people to prevent the disease in the first place. Now, when we look at other viral illnesses for which antigraphis has been tested, we've seen that it inhibits dengue virus, influenza A virus, H5N1, which is bird flu or avian flu virus, chikungunya virus, say that 3 times fast, human immunodeficiency virus, HIV, which leads to the disease AIDS, and the Epstein-Barr virus as well. Some of the additional immune benefits of antigraphis is that it's antibacterial, it's immune modulating, it boosts cytotoxic seed cells and natural killer cells and phagocytes. It does a lot of things with our immune system, but one of the things I love about antigraphis is it does not, so far in research, it has not been shown to rev up autoimmunity. So as you know, there are certain types of diseases that are called autoimmune diseases, and probably the best known is rheumatoid arthritis, but there's others as well. And so what they've looked at with, some people are concerned, if I take something that makes my immune system stronger, will it make the immune system stronger to attack me because I have an autoimmune disease? And so far what they've found is that antigraphis does not strongly affect that part of the immune system that's involved in autoimmunity. Now, one type of autoimmune disease is multiple sclerosis, where the body is attacking the myelin sheath on the outside of the nerve. And they did a 13-month study on antigraphis and multiple sclerosis and found at the end of the study, well, not only did it improve the symptoms of MS, but it did not exacerbate or cause the illness to be worse in any way because of its impact on the immune system. So how do you use antigraphis? Well, you want to make sure that it has a certain amount of antigrapholides. The studies pretty much found that about 80 milligrams of antigrapholides in antigraphis, usually in a really powerful antigraphis, that would be about 400 milligrams with 80 milligrams of antigrapholides. These key compounds seem to be crucial in delivering the medicinal value of antigraphis. I like to have a leaf and a stem extract because there are other compounds in antigraphis beyond antigrapholides that do have powerful immune system and overall health benefits. And so I believe that even though antigrapholides might be the superstars right now, they still work better when they have the help of all their brothers and sisters. You can take it every single day. For example, if you have a lot of exposure, my youngest son, for example, a college student, and his part-time job is delivering groceries. And he does take precautions, but I worry about his exposure every single day because because with what he's doing, he comes into contact with a lot of folks. So absolutely, he gets one of these every single morning along with some of the other products that I recommend to him. You can also use it if you become ill and you haven't been taking it, get it on board as quickly as possible, and it can help shorten the duration and lessen the symptoms. The next compound I want to talk about is propolis. And propolis, people sort of think propolis is from bees, and I guess that's a little bit true, because we wouldn't have propolis as an extract if we didn't have bees. But propolis is actually made by plants, and the bees like the propolis, so that it comes from a lot of trees and shrubs. So the bee collects the propolis from the plant, stores it in its little bee pockets, and when it gets back to the hive, it mixes it with certain enzymes and turns it into a paste that seals the hive. Any cracks in the hive or covers up imperfections or seals off areas that might be infested with some kind of microorganism that can harm the hive. So propolis is really sort of a joint effort between the plant kingdom and bees. Propolis is sometimes called, they sometimes call it bee glue, but to me, I don't really like that because it sounds like you're gluing the bees onto something. It's not. It's something that they use to fill in the cracks. It's something they use to protect the hive. In fact, propolis means protector of the city. There's over 300 different compounds that they've determined thus far in propolis, resins and polyphenols and other things that can play a role in its health benefits. Now, propolis has been used in a variety of different studies. It has some excellent antiviral activity. I like this study because it's on earache and sore throat. And this is on 56 children ages 2 and older, and they had earaches or sore throats or both, and they were treated with propolis or were watched without any treatment for 3 days. Because these were viral infections, of course, no antibiotics were prescribed, and after 3 days, the propolis group with earaches had a 75% improvement, and the sore throat, those with sore throats had an 88% improvement. Those children that were only watch and waiting, they did not receive the propolis, only saw a 20% improvement in earache and a 64% improvement in sore throat. So it pretty dramatically illustrates the ability of propolis to help infective symptoms resolve so much faster. Here's a study on propolis and the common cold. 50 people with common cold, so rhinovirus, divided into 2 groups, one that received propolis every day and one that received placebo. The placebo group recovery, about 5 days after the majority of those people were recovered. Look at the differences, though, in the propolis group. After 1 day of treatment with propolis, 5 of the patients were completely recovered of the 25. After 2 days of treatment, 16 of the patients were completely recovered. And after 3 days of treatment, 3 patients were recovered. So 24 of the 25 people in the propolis group were completely recovered in 1, 2, or 3 days versus the average of the placebo group was 5 days. So a dramatic reduction in time spent being ill. So about 89% of the propolis group recovered in 2 days or less. So that's pretty amazing when just looking at the common cold. And common cold is usually not life-threatening, but boy, it can sure make you miserable. Be careful, though, when you're looking at propolis, because propolis, the way the bees make it, is mixed with beeswax, and there's some other crude or impurities. So when you buy most propolis products, make sure you look for a product that's been screened and purified to remove the wax, the inert resins, the impurities, so that what you're getting is all propolis instead of 2/3 carrier and 1/3 propolis. So if you get the purified propolis, about 200 milligrams daily for general immune support. If you become ill with cold and flu, it can be useful for yeast infections because it does have some antifungal activity. There are a couple of studies on propolis and peptic ulcers. It also has some activity against bacterial illnesses, but I think it particularly shines with viral illnesses. Next, I want to talk about curcumin. Curcumin from turmeric. And when we think curcumin, we often think inflammation, or maybe we think arthritis, or maybe we think about the excellent cancer studies. Is there anything curcumin cannot do? It is certainly a multitasker, because it turns out that curcumin can play a huge role in your defense against becoming ill from viral illnesses in the first place and the resolution of illness after the fact. It has antiviral properties. It's been used in numerous studies looking for activity, and what they have found is that it has activity against HIV, 3 different types of influenza that they studied, PR8, H1N1, that's swine flu, H6N1, human, HSV1, HSV2, those are the herpes simplex viruses, the upstairs and downstairs infections, Coxsackie virus, hepatitis B and C virus, HPV, human papillomavirus, associated with both genital warts and cervical cancer, Japanese encephalitis virus, and human T-cell leukemia virus. There's over 300 studies on curcumin and its impact on viruses. This is just, to me, an ongoing part of my every single day protocol. Curcumin, I skipped one. Curcumin inhibits viruses. It has been shown to increase antioxidants, increase the destruction of infected cells, and target viral proteins for destruction without damaging the healthy cells. They are able to, these curcuminoids in curcumin, decrease viral replication, so they interfere with their ability to create more little clones of themselves. They decrease the ability of the virus to attach to the cell in the first place. They decrease the ability of the cell to worm its way in, and it inhibits viral replication. So excellent activity from curcumin on, as I said, a great multitasker, certainly working on more than one mechanism associated with viral infections. So a lot of people have been asking the question of how does curcumin work when we're talking about COVID-19? So there are papers that have come out in 2020 stating that curcumin might indeed be effective against COVID-19 by inhibiting entry into the cell, inhibiting encapsulation of the virus, so not letting the virus protect itself once it's in the cell, manipulating certain cellular pathways involved in inflammation and antioxidant activity that helps the body to rid itself of the virus, influencing ACE gene expression. And ACE gene has to do with the attachment points of the virus on those tissues that it's targeting, and helping to prevent abnormal blood clots, which is a bizarre effect that we have seen of COVID-19 infections. Authors have noted that many countries in Southeast Asia, which are frequent consumers of turmeric, appear to have lower numbers of cases and much fewer mortalities. So, curcumin also has been shown to protect the lungs. It protects the lungs from the damage that can be done by viruses. So, as many of you may know, even individuals who survive COVID-19, many of them have some level of lung damage after infection. So, in an animal model of influenza, they found that it significantly increased the survival rate. It reduced measures of lung pathology, and pathology is just a fancy word for sickness of the lung, reduced the level of viruses in the lung tissue, and improved the condition of the lungs even after the infection was over. It also prevented the lungs and protected them by its ability to regulate the immune system so that it didn't progress to high levels of inflammatory cytokines, which are precursors to ARDS, acute respiratory distress syndromes, and that cytokine storm we sometimes hear mentioned in the news. Now, the beneficial compounds in turmeric are curcuminoids. So turmeric is the plant, and it's a wonderful and healthy plant. And if you like turmeric, I hope you eat it or drink it every single day. However, turmeric doesn't have very much curcumin in it. It does have some healthy beneficial compounds, but you'd have to take buckets of it. So when we look at the medicinal compound upon which the clinical studies are done, it's called curcumin. And it's a family of compounds called curcuminoids. And even though the family is called curcumin, one of the curcuminoids is named curcumin as well, so it gets confusing. Also, the turmeric rhizome, from the turmeric rhizome, also has some turmeric essential oils. And the essential oils of turmeric do not contain any curcumin, but they contain other compounds called turmerones that play a role in boosting curcumin's absorption and keeping it active after absorption. So using turmeric essential oil and curcumin in conjunction, and there are some formulations that have done just that, can make a tremendous difference in outcome and in the power of the curcumin. So it's a safe and effective way to boost absorption and to make curcumin more powerful. The dosage for most of this work has been about 750 milligrams of curcumin enhanced with turmeric essential oil. In some instances, may need to go up to 1,500 milligrams daily, sometimes even a little higher still. All right, on to the berries. Elderberry is much in the news, and elderberry has some very particular anti-influenza benefits. Elderberry stops activity of the virus in more than one place, so it helps to prevent the cell penetration in the first place. It also coats the spikes of the virus so it can't penetrate the cell. So elderberry stops the virus from entering the cell, and it increases the activity of the immune cells that kill viruses. So it's really working on two fronts. it is keeping the cell from getting, it's keeping the virus from getting in the cell, while at the same time calling out the troops to say, hey, come over here. There's a bad guy here that you need to take out. So the ability of elderberry to coat the spikes of a virus, which is where it attaches, is particularly beneficial because coronavirus is called corona because corona means crown. And it has so many spikes it looks like a crown. So when we're dealing with COVID-19, which is a coronavirus, it is a particularly spiky virus. So using compounds that can interfere with the ability of those spikes to attach is a particularly beneficial herbal intervention. There was a great study in Australia on using elderberry to protect air travelers, because when you travel to Australia, you are very often in that airplane cabin for a long, long, long time. And you're rebreathing air, and you're in very close proximity to strangers all around you. So what they decided to do was to give elderberry, a specific kind of elderberry called Hirschberg Austrian elderberry. That's a very potent form. So they gave this elderberry to half of the passengers on the airplane, 312 passengers in economy class, traveling from Australia to overseas destinations. So half got the Hirschberg elderberry, half received placebo, and then they just watched what happened. After the flight was over, for a few days later, all the passengers were surveyed for cold and flu symptoms. They were surveyed before, during, and after those flights. And what they found is the elderberry group had half as many illnesses. It cut the illness rate for cold and flu by a whopping 50%. And if they did get sick, those few that did get sick that were in the elderberry group, their illness only lasted 2/3 as long as the placebo group, and their symptoms were not nearly as severe. So a really dramatic demonstration of the ability of elderberry to prevent illness and to lessen its severity. So how do you use elderberry? Well, you can take it every single day, especially if you're in the middle of a pandemic. May not be such a bad idea. The dosage in the studies ranges anywhere from 200 to 1,200 milligrams. It's very safe. I like to use elderberry in conjunction with vitamins A, C, and D, zinc and calcium and magnesium, because these are crucial, essential nutrients that help the immune system to become strong and resilient, and partnering that with elderberry is a great 1-2 punch. Now I get to talk about one of my favorites, which is vitamin D, the sunshine vitamin. Well, this is really kind of not true. Vitamin D is indeed associated with sunshine because when sunshine strikes your skin, it sets in motion a domino effect, which creates vitamin D. We do not absorb vitamin D from the sun. Our body has to make it. But the whole process is triggered by exposure to sunshine. Well, most of us are working at jobs where we're inside most of the time. Most of us are not spending a great deal of time in the sun, and if we are, we're worried about skin cancer and skin wrinkling, and we're using a lot of sun protectants. So I'm not saying that I am promoting going out and getting a terrible sunburn. That is not healthy for you, and it's not healthy long term. But exposure to sunshine is not a bad thing. It is, in fact, quite a beneficial and healthy thing. Vitamin D is absolutely crucial for immune function. When they looked at a study comparing vitamin D to placebo for respiratory infections in the wintertime, the placebo group had double the number of days and symptoms than the vitamin D group. So just that one single intervention made a huge difference in illness. One meta-analysis found that vitamin D supplementation reduced the risk of acute upper respiratory tract infection by at least 12%. It's called the seasonal stimulus because one of the reasons that flu epidemics occur in a seasonal pattern is because of vitamin D creation. We don't have as much cold and flu in the summertime because, this is the theory, is because you have a much better rate of producing vitamin D in the summertime than you do in the wintertime, especially if you're living in northern climates. So there's a lot of things that can interfere with your body's ability to make vitamin D. Some of it's genetic. Some people just got dealt a crappy hand of cards and they're not very good at making vitamin D. But there's other reasons as well. Did you know that after the age of 60 or 65, your ability to make vitamin D dramatically decreases? Also, if you are overweight, if you have a lot of fat under the skin, or any excess levels of fat under the skin, it interferes with the mechanisms that the body uses to make vitamin D. So people that are overweight and obese often have diminished vitamin D production. Last but not least, one of the raw materials that vitamin D uses to make, or the body uses to make vitamin D, is something you've heard of before, and it's called cholesterol. And so when in our battle against heart disease, where unfortunately cholesterol has been earmarked as the culprit, which I do not agree with. I believe in cholesterol balance, but not dramatic cholesterol reduction at all costs. So by taking drugs to wipe out cholesterol, we're also wiping out one of the raw materials used to make, you guessed it, vitamin D. So what about vitamin D specifically with COVID-19? What they have found so far is that people with the highest levels of vitamin D have the lowest level of mortality. That means death from the disease. So for every standard deviation increase in vitamin D, the odds of a mild outcome versus a severe outcome were increased about 8-fold. The odds of a critical outcome were decreased about 20-fold. So people that were replete, this is not a time where you want to be average, not just average levels of vitamin D, but superb levels of vitamin D had a dramatic decrease in risk of mortality and severe illness from COVID-19. Those who had the lowest levels of vitamin D had the highest risk for ending up in intensive care and ending up needing assisted breathing. So it appears to protect also against cytokine storms, which cause lung damage, and lung damage, and the overactivation of the immune system, and death in COVID-19 patients. So vitamin D, at a minimum, is something that needs to be incorporated every single day. And if you are over 50, and if you are not outside all the time in your two-piece swimsuit, if you are not getting a lot of vitamin D from foods, you absolutely should be thinking about supplementation. So here's looking at COVID mortality. Only 4.1% of patients with normal vitamin D levels succumbed versus 98.9% of vitamin D deficient patients. So you would be shocked at how many people in America have vitamin D insufficiency and downright lack of adequate levels of vitamin D to even do the most basic parts of immune system functionality. Studies have shown that for preventing respiratory infections, you can take it daily or weekly. If you are working with an integrative healthcare practitioner, sometimes they do injectable weekly doses, but you can certainly get there with daily doses of 2,500 to 5,000 IUs. If you have certain risk factors that show that your vitamin D status may be compromised, if you're older, if you struggle with some excess weight, if you have osteoporosis or osteopenia, these you might require higher levels. If you have hypoparathyroidism or hyperparathyroidism, relatively rare syndromes, you have to work with your doctor on adjusting your vitamin D levels. But other than that, I think most individuals would do just great with taking a very generous amount of vitamin D every single day. Last but not least, I want to mention selenium and zinc. They kind of got pushed to the end because I think we're going in alphabetical order because we started with andrographis and we're ending with zinc. But selenium and zinc are minerals that we do have some availability in food, but a recent health food survey found that 92% of the stores reported an increase in zinc sales during the pandemic, topping all other supplements because zinc has been shown time and time again to interfere with viral illness, whether it's a zinc lozenge that you suck on to keep it from attaching in the sinuses or in the throat in the first place, or systemic zinc were used by the immune system to prevent infection and to fight back against infection. Selenium is also another crucial mineral element that your body needs to have a strong and powerful immune response. So zinc, in addition to boosting immune system activity, has antiviral properties. In cellular studies, they found that zinc inhibits SARS-CoV by interfering with viral protein synthesis and function. That means that it interferes with the ability of the virus to use the resources within the cell to make new viruses. Zinc deficiency increases pro-inflammatory cytokines. Zinc deficiency decreases your ability to make antibodies, which are the immune cells that are specific to the virus you're trying to get rid of. When we talk about selenium, it's another one of those compounds that helps to prevent the virus from getting into the cell in the first place. It's been found to prevent the development of polio and influenza viruses in different types of scientific studies. And it's also a cofactor in glutathione production, and glutathione is a powerful detox agent and antioxidant made in your liver. So when we look at nature's answer to antivirals, or that there's so many things that we can do, boosting our nutrients with vitamin D, selenium, and zinc, using herbs like antigraphis, elderberry, and curcumin. There's just so much that we can do that can boost our immunity, that can help our immune systems be powerful and strong to help us survive and thrive. Thank you so much for your patience. I know this was a long presentation talking about a lot of different interventions. Sometimes I've been told that when you go through some of these, it's like trying to drink water from a fire hose. So I appreciate your sticking with us. I see that we already have a bunch of questions and answers in the QA box. Let me just pull that up for a moment, if I might. Do you have to build a base of these supplements before they're effective against viruses? Well, especially when you're talking about vitamins and minerals, yes, they should be on board every single day. Does that mean they're not useful if you become ill? No, but they, just like most things, when you already have a goodly base on board, it's going to help. But if you become ill, it's never, never too late to get these on board to help improve your outcomes. Do any foods contain propolis, or can you only find it in supplement form? No foods that I know of contain propolis. I know that you can buy crude propolis from beekeepers if you want to eat like the crude propolis, the waxy crude propolis. But most of the research has been done using it specifically as a supplement. If the virus is in the body but cannot enter a cell, what happens? Where does it go? Well, it sort of hangs out in the fluid parts of our tissue, and the white blood cells that are constantly on patrol come along and they go, wait a minute, this looks like somebody that oughtn't to be here. And the white blood cell, depending on what kind of white blood cell it encounters, either gobbles it up and digests it, or dissolves it with enzymes, or in some other way takes it out of circulation. So if it doesn't get into the cell, it's extremely vulnerable to our immune system coming along and getting rid of it. All right. So forgive me, I have my looking in the QA box is kind of frozen. So let me just do this and try to get it moving again so I can scroll. So I cannot see all the questions and answers, so I'm going to have to try something else to see if I can see them. You said antigraphis for autoimmune. Any specific dosage to start with, even with a non-specific diagnosis? So I'm careful to never say always and to never say never. Because while all the inclinations are, and all the indications as far as that antigraphis does not exacerbate or make worse autoimmune diseases, I always hope that individuals will talk this over, weighing the risk versus the benefit with their healthcare practitioner, because we don't know every single potential combination. We can't foresee the future. So the dosage to start for antigraphis is dependent upon how strong the antigraphis is. So the best antigraphis is usually in dosages around 400 milligrams of the whole herb, with 80 of those milligrams being specifically those antigrapholides I talked about, which has all that clinical research. And I would say once or twice a day, that dosage once or twice a day. Are there any dosage suggestions for elderberry for a 16-month-old and a breastfeeding mom? Well, to the best of our knowledge, we have not seen any issues with Breastfeeding mamas using elderberry or elderberry in conjunction with vitamins and minerals having any adverse impact on quality or quantity of breast milk. 16 months old is starting to get into a range where the baby is eating a wider variety of foods. If the 16-month-old is still only eating breast milk, I would be very cautious about introducing elderberry because the less sophisticated the immune system, the less sophisticated digestion, then the more likely to have some kind of adverse event. However, if you have a 16-month-old that has a viral illness, you're working with a healthcare practitioner, a little bit of elderberry might be very, very useful indeed. Hopefully not elderberry wine because they're too young for that. But other than that, other kinds of elderberry. Not raw elderberry, by the way. Elderberry has to be processed. You can't eat raw elderberry. It is not good for you. It contains certain toxins that are problematic. But when you look at cooking or when you look at turning it into a wine or doing an extraction, it's incredibly potent. Oh, thank you. I have a couple of very kind comments, so I appreciate that. Lexi, did you want to unmute any of our call-in users to see if they may have questions? Because I know that if they're on only via phone, they can't ask their questions.
Unfortunately, with our setup here, I don't believe I can open the phone lines the way I can in some of our other platforms.
Okay, all righty. Well,
so they will need to use the chat box if they are on their computer, and I apologize for anybody who's listening on the phone only.
All right. Well, if you have any other questions, then feel free to send them in the Q&A box. Just type them in. If you are on phone only, feel free to, because we have reached out to you with the kind support of Mother Earth, you can certainly go in there and talk to them about their questions, and I'm sure they can get in touch with me, and I'll do my best to answer. What's my take on the federal guidelines for COVID? Well, I'm not exactly sure what federal guidelines you mean because they are all over the place. I think that there's a lot of people working in healthcare that are trying very hard to do very good work. There are different areas of the country that are being very hard hit by this virus. There are certain populations that are being very hard hit by this virus. I absolutely have faith that we will get on top of it. The more people we have that boost their immunity, the more people we have that are strong and resilient, that build up a defense against this virus, the better it is for everyone. So, there has been an enormous amount of confusion. I've been in healthcare a very long time, and I don't remember another time in history where we've had this level of confusion and disagreement between experts, between the states and the federal governments, between the states and the city governments. And then it doesn't help that it's become politicized. So then you always are wondering, well, what lens is this being viewed through? So I think take a conservative approach, do our best to, love our neighbors and take care of them as best we can. If you're sick, stay home and pamper yourself, regardless of whether it's COVID or not COVID. We don't need to be coughing or sneezing on anybody. And boost your immune system. Take some of these spectacular herbs, vitamins, and minerals that can make all the difference. All right. Any other questions or comments, folks? Not another questions, but autoimmune. Let's see. And any questions about elderberry? Yes, we're not aware of any issues with elderberry and autoimmunity, but again, as I said, we err on the side of caution. I also had a message from the folks at Mother Earth that are in attendance that they said that if you need more information on any of these ingredients, or if you're looking for any of the herbs or the vitamins and minerals that I mentioned today, just stop on in and they will help guide you to the best of the best. Any other questions, folks? Well, I'm scrolling through to make sure I didn't miss anything, and I don't think I did. So thanks again, everybody. I appreciate you taking time out of your busy day to learn more about ways that you can protect yourself and others with excellent dietary supplements, herbs, vitamins, minerals that can all make a big difference in the strength and the resilience of our immune systems. Our bodies are miracles, and they can do the miraculous, but sometimes they certainly need a little boost, don't they? I hope that I'll have a chance to talk with you again sometime, and I hope maybe next year, when this time comes around, I'll be there in person, that we can say hi in person to each other. But until that time, I'm wishing you all the best and good health to you. Bye-bye.